Joining me now in the studio is Wenliang, who is the East Asia correspondent for Deutsche Welle, and he's been following the coronavirus outbreak very closely. Thank you so much for joining us in today's program.
Thank you for having me, Andrew.
I want to talk a little bit about the numbers. One of the things you've been doing is you've been giving kind of an updated list of how many cases there are, how many confirmed cases, how many people who have recovered, how many deaths. For the figures that are coming out of China, there's also been reporting saying that these numbers may be much smaller than reality. What is your take on that based on what you've been reading and the people who you've been following who are actually on the ground in China?
So what I've been reading and also what on Chinese social media is, for example, a lot of the times there would be desperate family members of some patients who are just very pissed or very frustrated about how the local hospitals are treating and handling the whole situation, so that they would go on to either Weibo or even Twitter to share about the difficulties of their family members trying to access the medical supplies or also even just getting doctors to check up on them. And there have been people sharing information about how once their family member died in the hospital, the moment that the family member died, the hospital basically call him or her and then ask them to basically contact a local cremation center and then ask the cremation center to pick up the dead body right away, because they don't want the supposedly contagious dead body to stay in the hospital for too long. And so when that happens, basically these deaths are most likely not recorded into the official figures that we're seeing that are released every day.
And now, are these people who have maybe not been diagnosed? They've passed away from, what some people are calling a serious pneumonia, but they haven't actually had the chance to have the official diagnosis of it being the new coronavirus. Is that why they're not being counted in?
Yeah, so actually the process of really confirming a patient as officially infected by the virus is a very complicated process in China. First of all, these patients with symptoms that are already happening need to line up for hours in order to just try to get a CT scan. And then a CT scan showing that their lungs are indeed being infected is not even enough to justify or qualify them for being considered as a confirmed case. After that, they also need to do other DNA tests to make sure that the virus, I guess, there are really traces of virus in their body. And so when that is confirmed, then they can be considered as a confirmed case of a coronavirus patient. But that process could take weeks. And for a lot of the people, a lot of the times, they probably have to go back and visit the hospitals day and day. And then with the traffic ban that are currently imposing in Wuhan, many of them living far away from the hospitals have to walk on foot to the hospital. And when your lung is already infected, for example, one of the sources that I've actually talked to, his father is really pretty much like very weak. And when your lung is, when you have to catch your breath and then barely be able to breathe just on your own, and you have to walk to a hospital, that's basically impossible for him to do that. So a lot of these people ended up, after the CT scan, they were given some medicines, basic medications that are and then they were asked to go home and, impose a self-quarantine for 14 days.
So, we're looking at already more than 20,000 confirmed cases. What is your understanding about, the actual number of confirmed cases? Is there kind of a consensus among people who are observing it about how much higher that number could actually be?
So there are experts saying that the number could already be at 100,000 now. But then again, that is only based on how fast the transmission can happen, as we have already seen by the confirmed numbers. It has way surpassed the number during the SARS epidemic. So they were saying that, and also because there were already 5 million Wuhan people that are outside of the city when the lockdown was being imposed.
Oh,
a couple
wow.
weeks ago. So imagine had that many people already been exposed to this virus potentially for weeks before they left for the Chinese New Year holiday.
And we should just give you an idea about the size of Wuhan. Wuhan is about 11 million people if you
Right.
count just the citizens of Wuhan. So to
Right.
have you're saying nearly half of the population may have been on the road
Right.
during the Lunar New Year holiday.
Right. And that's
Okay.
actually an admission made by the local government when they were being questioned about, the whole effectiveness of the lockdown.
Now, you've been following this pretty closely since January. What is your understanding about the Chinese government's response to this? Is this too little, too late?
Yeah, so a lot of the reporting, including the local sources that I've actually talked to, are saying how in the beginning, the relevant information about the actual what kind of virus it is, and then like how can you contract it, and also how it is transmitted, are all very vague. And like the information that they're getting, right before the lockdown was basically it is containable and curable in the beginning. But then when the numbers are really surging over the a few days before the lockdown, and then when the Chinese experts in Beijing finally came out and say that it's clearly that they're already seeing signs of limited people-to-people transmission, that's when they realized that then the government has been hiding up some of the key facts for weeks before they came out and admit that they can no longer conceal the very key information and the extent of the infection by that time.
So it was roughly around January 23rd when the lockdown occurred. So basically, they locked down the whole city of Wuhan. That's when we started to get kind of more information from the authorities in China.
Right. So, but then the first few cases existed in like the end of last year. So there is
December.
about a 3 to 4 weeks period where people are still not very aware about wearing masks and wearing, washing their hands. And they still go to even the seafood market that was the place where the virus originated from was still operating for 1 week before they officially closed it down. So imagine how many more people were already exposed to that virus before the government started taking the more serious measure to really try to contain it.
Now, you've also been following kind of what online people are saying online in China about the government's response. What are you seeing there? Like, how are people responding to the way it's been handled in China?
So when it was only the local government handling this whole situation, the frustration was up the roof, that basically everyone was complaining and then criticizing, and their frustration was so strong that you could feel like if the central government did not intervene and really take it over, I don't know, some sort of revolution could have happened at any point at that time. But then when the central government took over, they quickly imposed and then also implemented a couple mechanisms to really kind of like comfort the local and ensure the local community that things are going to be okay once the central government take over. And then they rolled out a couple programs, kind of like the makeshift hospitals that we're seeing right now popping up, not only in Wuhan but in several provinces that are copying this model. So when that started to happen, at least people are feeling a little bit more assured about maybe this epidemic is not going to get out of control.
So sort of like the dissent online or people speaking out against the government response, that has kind of settled down a little bit in the past couple of weeks since they've rolled out more draconian measures.
Right. And the other reason of why we're seeing less of the very sensitive and critical takes on the government's handling of this is because actually over 300 citizens have been either put into a temporary detention or be fined for sharing relevant information about the virus online. And that has not only been in Wuhan, but also all across China. And a very prominent Chinese activist, Hu Jia, he was actually took away from his house and put into a temporary detention when he was originally invited to go on air on Radio Free Asia's show last weekend. So that also just shows how insecure the Chinese government is about having the full extent of the epidemic being revealed to the world.
What are you worried about most right now in terms of this virus continuing to spread in China?
I think what I am most worried about is the number of the recovered people, because I've actually been seeing a lot of these more I consider as propagandic information or short messages about, oh, how many people were discharged from this hospital in what province, and then they kept highlighting that number, but at the same time, there just isn't that much information about how did these people recover from this virus, and then what are the treatment that they went through, because I think these information will be very important not only to people in China but also around the world, because then the whole world will have a better understanding about it. And also the fact that the US government claimed that they're I guess they're attempt to convince the Chinese government to let their experts to go inside China and help them have been either ignored or not addressed until yesterday, for weeks, then that also just shows how either China is still insecure about the outside world getting the first-hand insight about the actual information and the details about this virus.
So I want to shift a little bit now to the situation here in Taiwan. How much of a problem is it that Taiwan is not able to participate in some international bodies like the World Health Organization, the WHO, also the ICAO, which governs international flights? How much of a problem is it that Taiwan is not in those organizations?
So, of course, the biggest problem right now would be Taiwan will not be able to really join the very important discussion that happened during the all those meetings, and then maybe Taiwan's problems will be different from other parts of the world because of the unique connection that Taiwan has with China and the amount of interaction that Taiwan has with China. So when Taiwan's case or circumstances are not being able to really be addressed or elaborated fully at the international stage, then the conclusion that they come up with, I would imagine, would not be able to completely adapt to the situation here. So I think that's also one of the reasons why the current administration has been trying really hard to either convince highlight the fact that being excluded from the WHO meeting could pose a serious risk to the global response.
Now, Taiwan also obviously experienced the SARS epidemic. This is something that happened in 2003. At that point in time, Taiwan was also not a part of the World Health Organization. And we should mention also that the reason why Taiwan is not a part of the WHO or the ICAO is because these are United Nations organizations. Taiwan is not a part of the United Nations. China claims Taiwan is part of its territory, even though the two sides are ruled separately. And China also says that it oversees the health needs of the people of Taiwan. Are they doing that?
Yeah, so that's exactly the controversial point, because while they kept saying that that no one cares about Taiwanese compatriots' well-being more than the Chinese government, it took them 2 weeks or more to finally agree to allow the group of Taiwanese people trapped in Wuhan to fly back here 2 days ago. And then there were, like we know, already some members of that group confirmed to have contracted the virus. So imagine that these people were still in Wuhan, and then according to many of them, accessing the local medical resources is extremely difficult. And then comparing to that to the level of the care that they can receive in Taiwan, then you can just see that China is basically contradicting its own claims of what's actually happening to these people who are being trapped in the epicenter.
Now, it's interesting, even though Taiwan really is hoping to, participate in the World Health Organization, there's actually been a lot of criticism for the way that the World Health Organization has handled this epidemic. Do you think that they are swaying to pressure from China in terms of what they're reporting, the types of information they're sharing, or their willingness to, declare a different level of emergency?
Yeah, for sure. Because most of the experts that I've interviewed all agreed that the WHO should have announce it as a global health emergency a week before they actually did last week. And the reason why they delay it later, actually, I think yesterday a French media revealed the inner negotiation that happened within the WHO is the fact that China put pressure on the WHO because they don't want the epidemic to be considered as a global threat, because they are worried about how the repercussion is going to happen to the country, like the travel bans that we're actually seeing right now being rolled out by more and more countries, and including Taiwan, who just announced that yesterday that they're going to take a stricter measure on people who have been to China, and specifically to Wuhan and Hubei province.
I'm curious to know, with countries actually speaking out on behalf of Taiwan. So, for example, Japan, also Canada have both spoken out on behalf of Taiwan's participation in the WHO. Do you think that this is actually a point in time where it might actually be more possible for Taiwan to participate, or there might be more support for this, and that could actually pave the way for Taiwan returning to the WHO as a participant or as an observer?
Yeah, for sure. I think the amount of the support and also the concern about Taiwan being left out of the WHO has been championed and also highlighted by so many major countries around the world. And their reasoning are all very consistent because, leaving out Taiwan, who actually could be one of the first few countries that are impacted by this epidemic because of its, again, close relationship with China and interaction with China, could actually pose a very serious threat to the global public health system. And also the fact that, leaving out any country and allowing the epidemic to have the possibility of spreading and growing in a place where the WHO is facing so many political challenges is actually going to, again, not be it's basically a counterproductive way of fighting this global disease in their views.
Now, so far, Taiwan has been largely successful in keeping the novel coronavirus outside of its borders. Right now, as of today, there are about 10 or 11 cases so far, less than a dozen cases. Why do you think that Taiwan has been successful in doing that, despite the fact that it's is not privy to WHO information or information from China?
I think the SARS experience has really left a deep trauma in Taiwanese people. So when the experts are correlating this virus to the SARS virus, people immediately raise their level of awareness. And also, we need to remember that there are some people who played a very important role during the SARS epidemic now at a very crucial position in the administration, including our vice president, who actually was the person who's behind the whole coordinating and orchestrating the whole combat against SARS effort at the time. So I think that actually helps a lot in terms of Taiwan being prepared for what could happen. And then we immediately set up these very strong and crucial guidelines to ensure that the loopholes would be blocked before the virus even started spreading within Taiwan.
How have people in Taiwan on social media responded to this outbreak? What are their thoughts about what's happening in China?
So, at least under a lot of the articles that we publish at Deutsche Welle's Chinese Facebook page, oftentimes what we see, it's if it's a report about how the Chinese government has not been really revealing the full extent of the epidemic, then a lot of the people would immediately project the stereotype that they have about the Chinese government and say, see, this is all because of what the Chinese government has always been functioning, dictating and being arbitrary, controlling all the flow of the information. That's why the epidemic happens. And there are some extreme examples that I've actually seen online where people are clearly frustrated about the Chinese government blocking Taiwan from joining the WHO meetings. And so they are saying how the whole epidemic spreading across China right now is the karma that the Chinese people had to endure because of its government's evil treatment of Taiwan. And I think those are the extreme examples of how a discussion about China often goes the more extreme direction in Taiwan, especially when it comes to something that's negatively impacting China and then also that originates from China, but it's probably going to have a potentially very negative impact on the world. And they consider that as it's all like China is all, it's all China's fault. And then like these people deserve it and things like that. So
Do you think this is indicative of what the average person in Taiwan thinks, or is this something that's just fueled by kind of the internet being what it is, the medium itself?
I would love to think that it's more like being hyped up by the internet and also the so-called echo chamber that we're seeing over here, especially we're just after another election. And then we're actually seeing also the political atmosphere here in Taiwan are sometimes influencing how the society is responding to things related to China. Because we also know that the government right now is standing very firm and highlighting, re-emphasizing many times about how Taiwan is being bullied by China. Maybe that also plays a little role in terms of how people perceive the role of China and what's happening over there.
What would you like to tell the rest of the world about how Taiwan is experiencing this outbreak of the virus? What do you think that people get wrong about Taiwan's response or Taiwan's experience?
I think a lot of the times what I see sometimes on like the international media or around the world is that people automatically still believe that Taiwan is part of China. So this whole response that China is rolling out probably is also being
Rolled out in
rolled
Taiwan,
out here, or
yeah.
like the similar challenges that China is facing are also happening here in Taiwan as well. But clearly, I think what's very important to know is that Taiwan has its own healthcare system and including a very different healthcare insurance system than China, and also the fact that the government has a full control about its border and the immigration policies and also the response that should be implemented at what stage. So when it comes to reporting about the impact of that on Taiwan, I think the international community just needs to remember that Taiwan, again, is a very de facto sovereign state that has its own capacity to really deal with what the potential impact that the virus is going to have on the island.
And this is really important to remember too when you're considering, banning people from certain areas entering your country or banning certain flights. We've seen this particularly with Italy stopping flights to and from Taiwan because Taiwan is not part of the ICAO and is actually listed under China. So when they consider having a flight ban for China, then Taiwan is automatically included in that. Do you think we're going to see more countries that are having a similar response to Italy? And actually, Vietnam also did that temporarily as well, but that's been lifted.
I think the foreign ministry did a very good job at, highlighting how the mistake again is originating from the WHO's designation of the status of Taiwan
And the ICAO.
Yeah, right. And then they made a very public and loud objection towards that, and they spent a lot of efforts trying to explain that to both governments and also to the international community. So I actually don't worry about that being repeated around the world anytime soon, unless the Chinese government again try to intervene politically and then trying to make sure that Taiwan does not use this chance as for being recognized as a separate part from China.
Now, you obviously have been following what's happening on social media very, very closely. I'm curious if you could talk for just a moment about Taiwan's government and how it's using social media to get the word out, how that maybe has changed since SARS, and maybe how that's different than, of course, how the Chinese government is responding on social media.
So definitely comparing to about, let's say almost 20 years ago by now, social media, the government now is very internet minded. So we're, especially this current administration, so we're seeing most of the important head of the government agencies, including our premier, are all on global social media, especially Twitter. And what they've they've constantly been using a lot of very creative ways to either roll out their policies or explain their policies and to the international community, and that's been receiving a lot of positive responses and receptions because of the fact that they consider Taiwan as trying very hard to be part of the international community. And I think that the utilization of the social media outlets have really played an important role for that. But as for the social media, the Chinese government's response to the social media, they actually just announced, I think, when Xi Jinping was actually given a talk during a very important higher level Communist Party meeting, he actually mentioned that the Communist Party need to start regulating more of the online articles or information on about the virus. So I think that we could potentially see a very different development on the Chinese social media in the coming weeks, because for the first few weeks when the government did not intervene, there are actually quite a few very useful information and also firsthand news and stories coming out of the epicenters and Wuhan. So
I
now,
think very early on,
Yeah.
there were 8 doctors, perhaps, or people working in the medical industry who had posted on the internet about their experiences and observations, and they actually were brought in for questioning about why they had done that.
Right.
And I think very quickly also hospitals posted notices saying that medical personnel were not allowed to speak with the outside world about what was happening inside the hospital.
Right, exactly. So that again just shows how tightly controlled the information about the entire epidemic is, and also we should always, think about whatever that comes out of the Chinese government's official responses. As in hindsight, we should always remember that these are information that are either already been filtered, and then it certainly tries to frame a certain image about the Chinese government in this whole epidemic, so that we're not going to only just blindly believe that this the entire picture that we're going to be able to see.
William Yang, again, we've been speaking with William Yang, who is the East Asia correspondent for Deutsche Welle and has also been featured in a number of different media, including The Guardian, BuzzFeed News, and whatnot. We'll have all the links to him below in the show notes. Thank you so much for joining us.
Thank you for having me.